state. Nonprofits contract with the state to provide mental health and addiction services for people with intellectual and developmental disabilities, housing and shelter, training for people returning from incarceration, local arts and cultural programs, and a lot more. And, we've talked about this with you before. They have been stretched thin by 15 years of underfunding. That was worsened by COVID and a workforce crisis that they still have not been able to extricate themselves from. And all that time, demand has continued to go up. The funding increases that nonprofits received in 2021 and 2022 are historic, but they just begin to address the long-term funding needs. We thank the governor and legislature for them very much. But this year, we're asking that the state increase funding for nonprofits by $186 million. That includes an increase of $50 million to health and human services providers who did not receive an increase last year, and a 5% increase for everyone, including Medicaid rates. And after the biennium, we're asking that rates and payments be indexed to inflation so that they can keep up with costs, the cost of providing services to Connecticut residents. We have the money. State budget is healthier than ever. 2024 will be the 7th straight year in which the state has a large surplus. And both OPM and OFA just last month or in November predicted surpluses into the future. So we can do this. Yet, in the face of this, nonprofits continue to be in crisis with unprecedented workforce shortage that I mentioned, with increased costs for things like energy, for insurance, for food, and skyrocketing demand. We understand if programs can't be funded if there's no money. We recognize how important it is to save, to be fiscally prudent, and to pay off long-term liabilities. But not so understandable is a reluctance to also provide the services that Connecticut residents need today when there are the resources to do so. It doesn't need to be one or the other. Both fiscal prudence and nonprofit services are about Connecticut's future. And the people employed by nonprofits, the people served by them, and the families of both are asking that 2024 be the year when nonprofit funding is the state's budget #1 budget priority. First, to talk about it, I would like to introduce Barry Simon, who is the president and CEO of Oak Hill, also the chairman of the board of the Alliance. He's going to talk about his organization's need for funding. We have a couple of other folks on the agenda to speak to you today to talk about their experiences, and then we'll open it up to questions and answers. So thank you again for being here.
So thank you, John Collin. Thank you for being here. I am the president and CEO of Oak Hill. We are the largest purchase of service provider with the state. We are a multi-service provider with a continuum of care that serves intellectual developmental disabilities, mental health, substance abuse, children, education, and aging adults. We serve tens of thousands of individuals every year. And as an organization, the decades of underfunding have impacted us in ways that it's an incredible challenge to keep these programs open. Over the past decade, we have closed day programming, group homes, which there are people on the wait list for those services. And don't really want to be reducing services that are desperately needed while you have individuals on the wait list. So we are also an 1199 union provider. So we are in a really strange relationship with the state where we are highly dependent on our ability to honor contracts. But our ability to honor contracts is as an industry. It's not just those contracts that have the same effect. Our ability to pass on wages benefits and the ability to retire are dependent on our relationship with the state on our Medicaid rates. So if we get no new funding, last year we experienced a 2-week strike. It is likely we're going to have to go into strike mode to plan. And we will end up continuing to close programs if we're not able to provide reasonable rates to cover our cost of doing business. And I want to be clear that we really appreciate over the past decade the wage increases that we received and the past COLA that we received. But one of our challenges in particular is that because we have some of our contracts that received 7% increases and some of our contracts that received 2% increases, it creates an incredible disparity amongst being able to deal with our staff. And as everybody knows, with the inflation that's been happening, we run group homes in throughout the state. We have close to 80 group homes or residential programs throughout all of that. And so heat, electricity, maintenance, all those kinds of things that have gone up as a result of inflation have taken a toll on our ability to run our programs. So our clients need to eat, our clients need to stay warm, our staff need to be in facilities that are appropriately dealt with. And without these funding increases, we are going to continue to struggle to meet these costs. It's going to have an impact on our services. It's going to have an impact on access to services. So without these funding increases that we're requesting, it is hard for us to imagine what we're going to be experiencing over the next couple of months. But I want to say that Connecticut has the money for these essential services. And if we get the funding that we need, we will be able to fire up group homes that have been closed, bring in the staff that are needed to get people off wait lists, and provide the quality care that we desperately want to provide. But it's this relationship that we're dependent on in order to meet the regulatory obligations and our ability to provide these services. So thank you for being here, and thank you for listening.
Thank you, Barry. Our next speaker is Heather Gates. Heather is the president and CEO of Community Health Resources, which is a statewide organization providing behavioral health services. She's also the vice chairman of the Alliance Board. Heather?
Hi, thanks, John Carl, and welcome everybody. We're pleased to have you here and appreciate your attention to these critical issues. CHR is a large provider providing services to individuals from all communities in Connecticut. Our sites are predominantly located in central and eastern Connecticut. We provide services under contract with the Department of Corrections, DEMIS, DCF, DSS, and DOH. We're serving about 25,000 children, families, and adults every year. And if we were to be fully employed, we'd have almost 1,000 employees. That fully employed part is a big challenge right now. We went into 2020 and the pandemic having not received cost of living increases on any of our Medicaid or grant sources for 10 years. It was creating a serious fiscal crisis within not only CHR, but across the behavioral health system, as well as with other sectors and providers. And then we hit the pandemic where, as we all know, our lives and how to manage changed radically. The need to provide crisis services, for example, was more critical than ever during those 3 years, as individuals could not necessarily access other more routine services. We're very grateful for the increases that were appropriated in the last several years. They basically pulled us back from a financial cliff and decision-making related to layoffs and closing programs. We closed programs sort of all along based on how they're doing, but usually in small numbers. We were at a point then in 2020 and 21 where we're going to be making significant decisions about closures. So that funding helped us maintain those. So here we are. The funding was really devoted to keeping us out of crisis mode and helping to address big changes in market demand for salaries. That was true with our clinical workforce, as well as the part of our workforce that is has bachelor's levels, as well as just experience to work in many of our programs. Those increases that we were able to give over the last couple of years helped reduce our turnover, which is very helpful. And we are deeply concerned that we're going to be heading into a year with a 0% COLA, where we will again experience increased turnover if we are not able to continue to keep up with the market demand. To give you a brief example, right now, one of our biggest areas of challenge for recruitment is in our clinical workforce. We have 42 clinician vacancies right now, and that means we are not serving at any given point in time, and this is not cumulative, several thousand individuals who those clinicians would be out there treating and meeting their needs. And so what does that mean? It means that there are increased suicides. There are children who are not getting the behavioral health services we know they need. We have adults who are dying from opiate abuse and cannot get into treatment if there are inadequate clinical staff in clinics and in community programs. Our crisis teams are not able to do the kind of outreach they need to do. So this is not an academic discussion. This is not an abstract concept about how the state wants to spend its money. This is about real individuals dying because the state of Connecticut is not addressing the needs of individuals who have serious mental health, substance use issues, and emotional disturbances. So I just urge the lawmakers and the state of Connecticut to step up and end this pattern of inadequate funding for the services that we provide and that so many other providers are providing as well. We need to continue to not only stabilize the system, but make progress moving forward so that as a state, we are doing what is just simply morally critical to do, which is to meet the needs of people who don't have other choices and whose lives are so affected by the conditions that they are trying to address. So we appreciate your attention to this, and we really hope that lawmakers are able to direct funding to the human service system, which is in such need at this point. So thank you.
Thank you, Heather. Our next speaker is Melanie Alvarez. Melanie is the Director of Programs at the Friendship Service Center in New Britain, which provides services to people who are experiencing homelessness.
Good morning. So grateful to be here. Again, I'm Melanie Alvarez. I am the Director of Programs at the Friendship Service Center in Central Connecticut. We're located in New Britain, and we serve the towns of New Britain, Bristol, Plainville, Berlin, and Southington. We are a very small region, one of the 7 coordinated access networks that many of you probably heard about around the state. And I'm really grateful to be here today talking to you about the issue of economics and homelessness and how we have been sort of kicking the can down the road, and we've reached the end of the road, folks. And we are desperate for your help and your assistance. We've seen about a 13% unprecedented historic rise in homelessness year after year in this state. And in a recent report published by the Connecticut Coalition to End Homelessness just about a week ago, there are about 800 individuals in the state of Connecticut that are experiencing unsheltered homelessness. This does not include individuals who might be in a cold weather overflow warming center or emergency shelter presently. These are literally individuals who are sleeping in their cars or in places that are unfit for human habitation. And there are many, many more people who need help right now than we are reasonably able to support. And our safety net system is on the verge of a collapse. If we see that collapse, that will result in lots of consequences for our state. So when we say that we have a healthy economy, that is not illustrated by the fact that there are 800 people, many of whom are minor children, that are sleeping in cars with their families. And I would just like to note that those are only the people that we know about. Many families who are experiencing unsheltered homelessness are reluctant to come forward because of the consequences that might result for their family in terms of removal of children and so forth. So this is an underestimated report. These issues are compounded by the staffing crisis that I think everybody is talking about here. And it is an unprecedented shortage of people in the workforce. The individuals that are working for us are members of the ALICE community, asset limited, income constrained employed, and they are forced to make decisions on whether or not to do this critical work when they can go and get paid more money at Target. And so that results in or some other commercial enterprise, and that results in a lack of professionally trained staff to deal with human beings who are complex and who are in crisis. Gone are the days when we could count on church volunteers, and we appreciate those kinds of things, but individuals with complex needs require individuals to work with them who have specialized training. And if we cannot pay them a fair living wage to do that work, we cannot retain them. That results in stress on our already stressed system. And again, we are on the verge of losing safety nets that are designed to save lives. The people that come through our doors on a regular basis are in crisis. And, as my other colleagues are talking about, in order to address these crises, we need resources to do that. So some of the things that we are asking for from the legislature, and we'd love to partner with you, about 7 cities in this state are burdened with, 85% of the homeless response. Those individuals are coming to us from smaller suburban areas that do not have the resources to provide that kind of support. We're calling on the legislator to help us with annualized funding to support operations for overflow, cold weather, and emergency situations. Winter comes every year. This has been repeated on and on, but we do not have annualized funding. We need some increases in funding for our diversion and hub centers so that we can avoid homelessness in the first place and keep people in place in their homes. Once somebody loses their home and gets caught in the cycle of homelessness and has to enter our system, it's very hard for them to find their way out of it. There are a lot of bottlenecks in our system that could be cleared up with resources. And we need to be able to increase funding for our CAN operations so that we can further optimize how those services are delivered and moving people through the system to alleviate some of those bottlenecks. In closing, homelessness is a solvable economics equation, and we know how to solve it. We have done it before with veterans homelessness. We have a functional end to homelessness for veterans in this state. We were nationally recognized. We are a state that has prided ourselves on being on the cutting edge of humanitarian efforts to, alleviate or resolve crises that people are feeling. So we need our legislature's help in order to make policy decisions that enable us to do this work and continue to save lives. Frankly, if we do not get people off the streets, they will succumb to the elements. They will be traumatized. They will experience higher rates of mental health issues and substance use disorders than our already burdened system is reasonably able to support. And you know, we also face barriers because of the prioritization of populations that we have to prioritize due to lack of resources. We have to turn people away, numerous people away every single day who are requesting our help. So we are excited about the possibility of having these conversations and sort of enlightening and bringing some of these things to the forefront. And I also appreciate your time. Thank you so much.
Thank you. You know, I think one of the issues that the people served by nonprofits have had to suffer is the fact that they're in many ways invisible to large parts of the population. People don't see them. And what our job has been as advocates is to talk about that. Heather mentioned a few minutes ago being brought back from the brink of disaster by the funding that happened. And nonprofits can only do the work that they can do as much as they can do because of the support of some of the people in the legislature who have fought on their behalf. We're really lucky to have a couple of them here today. And to start off, I will ask Senator Cathy Osten to join us.
So I think it's still morning. Good morning, everybody. I appreciate being on Zoom today. As many of you know, I was slightly clumsy and broke my leg, and so I'm a little bit having a little bit of problems with mobility. So I appreciate being on Zoom. So we've done a lot of work for the nonprofit community over the last 6 or 7 years, making sure that we were starting to bring wages up, making sure that we were providing resources for not just wages, but for the increased costs in food and insurance, heating, and looking to get nonprofits to start releasing the grants for infrastructure improvements, which I think is also really important to make sure that the more than 1,000 group homes that we have in total between the Department of Developmental Services and the DMIS, the mental health group homes and DCF group homes, that the facilities are in good order so that we can move things forward. Now, one of the bills that I will be putting in appropriations this year is to make sure that all nonprofits are treated equally, so that a wage does not go to one segregated section of nonprofits. I think that that's important for us to do that. I'm of everybody on this Zoom, I know full well the structure of the budget, the complications and limitations that are put on us by the spending cap and revenue cap and other financial guardrails that are the building blocks of any budget that we have. These are things that everybody in the legislature voted for last year. I think it was 100% in the Senate and 100% in the House. We will have very little flexibility in this upcoming budget. My goal is to provide what we can for our nonprofits within the confines of those dollars that are available, and see what my other colleagues think about where we are. Now, Representative Walker and I have been meeting with people. We have requests of over $600 million so far, and suffice it to say, there's not $600 million available. So this is where we sit today. I am committing to working with everybody to make sure that we parse out the dollars that we have, making sure that all nonprofits are treated equally, which I think is a very important component of our budget, so that we're not picking one group of nonprofits over another and not one group of clients over another. These are very important things that we do, and I look forward to speaking with all of you as we move forward. Thank you. Thank you, John Carl.
Thank you, Senator. And Senator Matt Lesser is with us today, also Chairman of the Human Services Committee.
Thank you so much, Jen Carl, and thank you as well to Senator Austin, who's been an important colleague and partner on the issue of nonprofit funding. You know, as the co-chair of the Human Services Committee, you know, I see my job in many ways as helping to rebuild Connecticut's battered social safety net after more than a decade of difficult austerity and budget cuts that really threatened our ability to, you know, meet our basic social compacts. You know, we talked a little bit about this morning about homelessness, but whether it's homelessness or the opiate epidemic or, you know, a number of other different crises, we have a lot of work to do to meet the needs of the most vulnerable in the state of Connecticut. And we are dependent on our nonprofit partners to helping us meet our core mission as a state. So we've been working to build that up. As Senator Austin mentioned, we've done some work over the last few years to try to increase funding, and we have a lot more work to do. And she's absolutely right that we are facing some significant challenges. A lot of them are self-imposed through the fiscal guardrails that make it much harder for us to invest in, you know, critical missions. But we have a lot of work to do this session to make sure that all of our nonprofits that are seeing increased costs because of inflation are able to do their jobs and are able to serve, like, you know, our family members, our neighbors who need help right now. So a lot of work to do. I will just say that, you know, in addition to fighting for additional funding, we've also been working with the folks here to allow you to do more with the resources that you have, which is why it was so important for us to retool the innovation incentive program and other, you know, and come up with other strategies to make sure that you're able to do more with the resources you have. And as the co-chair of the Human Services Committee, I'm committed to working with my co-chair, Representative Gilchrist, and we'll continue to work with the folks here to do everything we can to allow you to do your jobs and to serve our communities. Thank you.
Thank you, Senator. Thank you for your help with that, and to both of you for all you've done for nonprofits. You know, I'll tell you a little secret, and that is that none of us, I think I can speak for all of us, none of us want to be here talking about this. Nobody wants to be doing this every year. But we do it, and we do it because it's important to the people who work for nonprofits, and it's important for the people who depend on them for services. A significant, between the two of them, is a significant chunk of Connecticut's population. This is about the quality of life in our state, and we appreciate anything that the state can do to help. And that's why we're here again, and we're going to keep coming every year until nonprofits are adequately funded. We can open it up to questions. Patty will yell at me if I don't say, please put your name in the chat box, and we will take any questions that you have.
Yeah, or raise your hand.
Or raise your hand.
We did have one from Keith Faniff, who actually just texted it to me, and the question was, John Carl, to ask you to just reiterate what the ask is for this session, and to ask Senator Austin to weigh in on that as well.
Sure. You know, what we're asking for is a total of $186 million, an increase of $186 million. We know it's a lot of money. That would be enough to bring all nonprofits first up to the same level as some were lifted to last year, then giving a 5% increase to everybody above that. It would also address Medicaid rates. But an important part of what we're asking for is that payments to nonprofits be indexed according to inflation, like several other things have been over the past few years, because they got to keep up with, they got to keep up with the costs, or else by definition, there are going to be fewer services for people in coming years. So that's what our main request is this year. This is this year.
Thanks, Patty. So Keith, quite frankly, $186 million is something that will be very difficult for us to reach. We've so far over the last few years not reached the goal for the nonprofits that they have asked for each year. We've made some significant increases to nonprofits. I think one of the most important things would be to make sure that all nonprofits are treated the same so that we don't have a bifurcation of funding increases. That's something that I think that we can accomplish this year. And based on whatever the governor presents us with a budget, to see if there's some ability to increase some of the funding, seeing where the governor's folks are attempting to go to.
Any other questions? You know, I do want to say that every budget is, people routinely at these things say that budgets are statements of priorities, and that is particularly true for the folks here today. And I think it's also a matter of choosing between, it's a matter of choices. Budgets are choices between competing priorities. Nonprofits have waited to be the priority for many years. And we think, we know we have support in the legislature. We know that people in the administration are listening, but we have to turn the resources that we have available to us, and those resources are there. If we have to make choices that make them available to the people who need nonprofit services, let's do that. We can work together and do that.
So if we don't have any other questions, I think we're good.
Thank you. Thank you all for being here.
Thanks, everybody. Talk to you all soon.
Thank you, Senator.
Heather, I
Thanks.
think I'm seeing you in a few minutes.